how common is PCOS? I really would love for women to know that it's very common. It's actually the most common hormone condition in women of reproductive age. It affects about 6 to 12% of women, and it just depends on the diagnostic criteria that we use. What I want you to remember is roughly 1 in 10 women have PCOS during their childbearing years. You are not alone. Millions of women worldwide live with PCOS. The common signs and symptoms of PCOS, if you're wondering, do I have PCOS? We'll talk through how we diagnose it in just a moment, but the main thing I want you to be noticing as a woman is your menstrual cycle regularity. We define a normal menstrual cycle to be within 21 to 35 days. And so if you're a woman who's noticing your menstrual cycles are coming less frequently than every 35 days, whether that's 36 days, 37 days, 45 days, 65 days, every 3 months, whatever it may be, I want you to see your OBGYN or a reproductive endocrinology and infertility specialist. We abbreviate that REI, like myself, because that's not normal. And as we'll talk about in a moment, it has other health impacts. It doesn't just impact your fertility. So it's really important to be seen and evaluated for this. PCOS can also just cause a complete absence of menses. And so if you're going 3 months or more without a period, I definitely want you to be seen and evaluated. These other symptoms below it are very common in women with PCOS, but they alone are not diagnostic of PCOS. If you're having irregular cycles and acne and hair growth, or irregular cycles and thinning hair, or irregular cycles and having trouble losing weight even though you're doing your absolute best, that makes me think PCOS. It's not just acne or just, a family pattern of having more hair growth, or just difficulty losing weight. It's really a full syndrome or constellation of things that we need to be thinking about it. No matter what, even if you don't have these other symptoms like acne or hair growth or trouble losing weight, if you have irregular or absent menses, I want you to see a specialist. So how do we diagnose PCOS? This is so important. So the current guidelines are to use something called the Rotterdam diagnostic criteria. You do not have to remember that. There's no test on this, but the important thing is that the Rotterdam criteria really mandates that we have 2 out of 3 of these conditions or factors. So it's not, we don't diagnose PCOS with just 1 of these. It has to be 2, and it can be any 2. Really the most important though, as far as impacting your overall health, your fertility, and the risks of PCOS is the irregular or absent menses. But in addition to that, we also need to see polycystic appearing ovaries on ultrasound, or physical signs, whether that's acne, hair growth, or hair loss, or blood work showing elevated male type hormones or androgens. So just to give you an idea of what we're looking for on ultrasound, and because it is so beautiful to see, this is an ovary that is a very stereotypical appearance for PCOS. What I notice is, first of all, this woman has a lot of follicles. The silver lining of PCOS, I like to focus on the positive, is that women with PCOS have a lot of eggs compared to other women their age. And so although I would love to be able to help you get pregnant very naturally with lifestyle modification or with simple oral medicine that we'll talk about later, when we need to do IVF for women with PCOS, the silver lining is you do so wonderfully well because you have so many eggs per cycle, and so you get a lot more eggs compared to other women your age, which gives you a higher chance of success. But you can see that here with all these little follicles here. They are around the perimeter of the ovary, so we call this a string of pearl appearance. And also what I want to highlight is what I referred to before. You can see that the middle of the ovary has all of this, we call it stromal tissue, and it just means tissue without follicles in it. Follicles are these little black fluid-filled pockets. You could kind of think of them as chocolate chips. There's no chocolate chips in the middle of this cookie. And that's important because the stromal tissue is made up of theca cells, and theca cells respond to LH, or luteinizing hormone, which produces more androgens. And so we don't know why women with PCOS have more theca cells or more stroma, but we definitely do know that that's part of why they have more androgen or male type hormone production. Okay, so again, I want to highlight we need 2 out of the 3 of these. Most commonly, what I see from my patients who are seeing me for infertility is that they will have irregular menses or absent menses, and then this PCO appearing ovary on ultrasound. Women with acne or hair growth or hair loss, or with blood work showing it, that can happen too. But really, these are the ones that the first 2 that impact fertility care the most. It's also important to know that PCOS is a diagnosis of exclusion, meaning, again, other things can be causing acne or hair growth. Other things can even be causing irregular menses, depending on what that irregularity is. So it is important to see an OBGYN or an REI to exclude these other more rare diseases. Okay, this is one of the most important slides to me that I really want to educate all women with PCOS on. There are other health risks when we have PCOS. The number one thing I'm thinking of for my patients, for the big picture, is I want them to know that if we do not have regular menstrual cycles, whether that's with improving our own ovulation function with lifestyle modification, or whether that's like being on birth control pills or having an IUD in place, some sort of hormonal contraceptive, if we're not treating it that way to ensure we have regular, predictable menstrual cycles, or to ensure that we have that IUD in place that's protecting our uterine lining, essentially over time with this irregular or absent menses, our uterine lining is going to go thicker and thicker and thicker. And over time, that puts us at risk of uterine cancer, a specific type called endometrial hyperplasia causing endometrial cancer. This is absolutely preventable, and it's super important that you have this protection for your uterine lining. Again, even beyond fertility or other concerns, I want you to see an OBGYN. And if you're not having regular cycles on your own, consider go on the birth control pill to protect your uterine lining and to prevent your risk of uterine cancer. There are reproductive risks as well, which we've touched on. So we can experience infertility due to the ovulatory dysfunction. There are also higher risks of pregnancy complications for women with PCOS. We know that there's a slightly higher risk of miscarriage. We also know there's higher risk of gestational diabetes and also of preeclampsia. I share this to empower you that we can mitigate these risks with lifestyle modification, okay? And we'll talk about that in a sec. Whether we're pregnant or not, there are underlying metabolic risks with PCOS. We are at significantly higher risk of getting type 2 diabetes in our life, high blood pressure, and high cholesterol as well. And essentially, these things all increase our risk of cardiovascular disease, so heart disease in the future. And so, again, I don't share this to scare you, but to empower you that we can reduce these risks with a healthy lifestyle. Interestingly enough, there's also psychological risks with PCOS, and this makes a lot of sense to me, you know, when if we're having an ovulatory dysfunction and experiencing infertility, that is oftentimes the most devastating experience women go through, and so there are higher rates of depression and anxiety. Also, if we're having trouble with acne or hair growth, or having trouble no matter what we do with weight gain and not being able to lose weight, all of those things really impact our sense of identity, self-worth, just positive feelings about ourselves. And so it makes a lot of sense that there'd be higher risks of depression and anxiety. And so I want us to be aware of these things so that we can get help for ourselves and also for our friends with PCOS. Okay, this is probably my favorite slide because although I am a doctor and I believe in the miracle of medicine and also IVF for my patients, I am an even bigger believer in lifestyle modification and what a healthy lifestyle can do for our well-being and our overall health. So things that we know can help with PCOS for women is a Mediterranean diet. A Mediterranean diet is a low inflammatory diet, so it actually can help our body with a variety of diseases. So Mediterranean diet is essentially focusing on fruits, veggies, whole grains, legumes, nuts. If you're pescatarian, include fish. We know that fish can help with fertility, by the way, for both men and women. This Mediterranean diet essentially also improves insulin sensitivity, which we've talked about. We understand insulin levels impact our androgen or those male type hormone levels. So if we can improve our insulin sensitivity, we can also reduce our androgen levels. A Mediterranean diet has also been shown to improve and support your cardiovascular health, and as I shared, your fertility as well. So I want you to look at your diet. I want us to shift from this idea of a diet or restricting or really anything that is not this vision. That I just want you to eat nutritious food. I want you to fuel your body. I want you to feel good. I want you to view food as medicine. And I think having that view that food is nutrition to help our bodies grow and feel alive is what's most healthy for us as women. To that end, I don't want to say go do exercise. I want to reframe that entirely. I just want you to move your body, and I want you to move your body with joyful movement. That's going to be different for everyone. I want you to explore what makes you feel alive in your body and just focus on shifting your identity to be someone who is active, who every day does joyful movement. Things that I recommend are aiming for at least 10,000 steps every day. So I want everybody to get a fitness tracker like me, and I'm always checking, and I want to get at least 10,000 steps. And I do this every day of the week, and I plan to do this every day of my life until I cannot anymore, until I literally am in a wheelchair and can't. So meaning in your 80s and your 90s, I want you to be getting 10,000 steps a day every day of the week. I park really far away in the parking lot. I do that at Costco. You know, my kids that know that mommy's getting her steps. I want that to be your new identity. And really what I'd love to get is 12,000 steps a day, 13,000, 14,000. You know, challenge yourself, but get at least 10,000 every day. Walking, especially outside in nature, is so good for our mental health. It's so good for our well-being, but it's actually so amazing for weight loss. And it's just the sustained effort of doing that every single day. You're not going to see an instantaneous change, but you will over months of doing this. This is going to be your new lifestyle, and you are going to see the weight loss. I also strongly recommend weightlifting. So this is on top of the daily steps, and you can figure out a regimen that works for you. But I show this woman here, again, positive choices, ongoing strength, our new definition of PCOS. She's lifting heavy. I want you safely to start at a weight that challenges you, where you can only do 6 to 8 reps, you know, and do 4 sets of that with a couple minutes break in between, and steadily increase the weight every couple of weeks. Focusing on lower body workouts is so great. So deadlifts, lunges, squats, hip thrusts. Our leg muscles are big, and we can grow them bigger. And the reason why that's important is that the more muscle we have, the better metabolism we have. So you will be, if you can build muscle, you'll be burning calories at rest, which is the ideal. It also just helps lower our androgen levels. It's by doing so, all of this supports ovulation, and of course boosts our mood and energy. So those are my personal recommendations to you. It's so important to understand that if we can lose just 5 to 10% of our weight, we can restore our ovulation function and regulate our menstrual cycles. And so this is the ideal for my patients. I also want to encourage you, you know, if you're doing this awareness but still struggling with weight loss, if you're planning for pregnancy in the future, I encourage you to speak with your primary care provider, because there are medications now like the semaglutides, like Wegovy or Ozempic, that can really help us on the beginning of our weight loss journey, and help us feel that sense of personal agency, seeing that progress. I wouldn't want you on those medications while you're actively trying to conceive. I'd want you to stop at least 6 weeks ahead of time. But if you want to work on this weight loss to see if you on your own can restore your own natural ovulation function and menstrual regularity, I love that for you. Okay, so let's talk about, I've done everything I can, and I'm still having irregular menstrual cycles. What is the main treatment for PCOS? So, and again, this is for women that still have ovulatory dysfunction, so their cycles are still greater than 35 days apart. For women trying to conceive, it's usually a very simple oral medication called letrozole. The brand name is Femara. This is a simple medicine that causes ovulation induction. It improves your ovulation function, and it just does that by synchronizing the hormones from your brain, those LH and FSH hormones that come down in a more concerted way to stimulate your ovaries to recruit a follicle. We want to do letrozole with ultrasound monitoring, so we make sure the dose is just perfect. Our goal is one healthy baby at a time, and the reason for that is it's safer for you and and we can see that on ultrasound, and because there is, a low risk of twins if you're not on the perfect dose of letrozole. And really, once we heal or correct that ovulatory dysfunction and get you to ovulate regularly, just with timed intercourse, meaning intercourse on your own at home, you have a great prognosis, a great chance of getting pregnant. For women not trying to conceive, to protect your uterine lining, the first course of treatment is birth control pills. So that's what I recommend to you. And the benefit of birth control pills when you're not trying to get pregnant, of course, is actually there's certain brands of it that have a hormone called drospirenone in it. That's common in Yaz or Yasmin, that specifically help acne and hair growth. So it's kind of a multifactorial treatment for you. Also, if you're still having acne or hair growth, you can add on spironolactone, which is a medicine that blocks those male type hormone receptors. You would never want to be on spironolactone while you're trying to get pregnant, because it's a teratogen, which just means it can cause anomalies in the baby. Happily, spironolactone gets out of your system, a couple weeks after stopping it, but never, ever, ever be on spironolactone when you're trying to get pregnant, and always be on a hormonal contraceptive while on spironolactone, because I would never want that to happen. For women who have a glucose intolerance associated with their PCOS, we see improved outcomes with metformin, which is a simple oral medication. And oftentimes I will use metformin in combination with letrozole, or use metformin in an IVF cycle to help a patient have that kind of holistic approach of addressing everything together. I really want to highlight, as my time with you draws to a close, the importance of community and supportive therapies when we have PCOS. Counseling and therapy is so good for each of us. It helps manage stress, anxiety, and depression. It also empowers us through building skills and self-confidence. And because we know that women with PCOS have higher risks of anxiety and depression, it's so important to be connected with a supportive therapist. It's also great, to consider a nutritionist to really help you dial into that Mediterranean diet and make it a habit that you can continue on your own. You can consider a personal trainer or joining different classes until really you're just building these little micro habits every day until they become your new identity. Support groups are available too. 1 in 10 women, that's so many of us, you probably have friends that have PCOS, and just talking about it together, sharing what you've learned, sharing about how it impacts you, destigmatizing it so we know how common this is. You can find groups online and real life as well. Anything that empowers you and makes you understand that you're not alone, I think is so valuable. I'm going to leave it to Tamara to talk about all the benefits of acupuncture, but exactly as she said, there's myriad benefits for acupuncture, and I can't wait to learn from her today in more detail. And finally, the holistic care team is so important, working with doctors, nutritionists, therapists, acupuncture providers for that whole person support. The heart of my message today that I'd love for you to take with you is remembering you are not alone. PCOS, again, affects 1 in 10 women worldwide. I also want you to know with the right support, treatment, and lifestyle changes, PCOS is manageable. Really importantly, even small steps like joyful movement, nutritious meals, stress reduction make a big difference. PCOS does not define you. It's just one part of your health and not your whole identity. And there is hope, healing, and community for you with PCOS, which again is positive choices, ongoing strength, right? Thank you everyone so much for your time, and I can't wait to hear from Tamara. Thank you.